Good morning, everybody. My name is Alyssa Bostwick, and I am the Chief Nurse and Operations Executive for Golisano Children's Hospital. I want to thank everybody here for joining us this morning, for taking time out of your morning to come celebrate with us and to hear this very important announcement that we have to make today. We're so grateful to each and every one of you, and I'm looking at all of our team there in the back, for how instrumental you all have been in getting us here today. Autism spectrum disorder impacts 1 in 36 young people, according to the CDC. In addition to that, there are those without a diagnosis that have sensory disorder and sensory sensitivity. What that means is, for us, we care for dozens of these children on a daily basis, right here in this building. Our true north is providing quality care to our children as close to home as possible. This is the passion and the purpose that drives this care team in this hospital every single day. That desire to serve every patient and meet their unique needs is what leads us here today. So, I am so happy to introduce to you today C-Star, and you'll see the balloons on the window and the flags on the table. It's Golisano Children's Hospital's one-of-a-kind program created to support and care for the patients and families in our community living with autism spectrum or sensory disorders. C-Star stands for Safety, Education, Awareness, Sensory Training, Autism Readiness. It is not a place or a piece of equipment, but a comprehensive commitment to our community that we will meet the unique needs of this population. From the colors on our walls to the location of our sensory-friendly spaces throughout this entire building and beyond, this program will ensure that the unique needs of every patient is top of mind when we are creating processes and policies as we continue to grow and advance to lead Southwest Florida in pediatric care. A large part of this program and commitment is education and sensory training. And so I am so excited to announce today that Golisano Children's Hospital is officially a certified autism center by the International Board of Certification and Continuing Education Standards for Care, Treatment, and Support of Patients with Autism Spectrum Disorder. A little showcase. This means that every single team member in this building that could possibly interact with a patient with autism or sensory disorder has been educated, trained, and officially certified as a certified autism healthcare professional. This is our administrative assistants, this is our environmental services team, our food and nutrition staff, our physicians, our nurses. Over 600 team members completed this training, took the test, and became certified. We are the first hospital in the state of Florida, and we are only the second full facility in the country to obtain this certification. Now I'd like to introduce Lee Health's Chief Medical Officer, Dr. Ian Gunzenhauser.
Thank you so much, Alyssa and the whole team here at Golisano. I'm here just to join in the celebration and the congratulations that are due Alyssa, Dr. Solomon, the team here at Golisano. This is a product of their passion, their effort, their ongoing commitment to the community that we serve here in Southwest Florida. This announcement is truly connected to the mission of the Lee Health System. And at a time like this, when we are so committed and so passionate about preserving that mission and assuring that we are positioned to continue that mission for this community for as long as anybody can imagine. We're committed to treating everyone in our community with care, with compassion, and with the utmost quality that can be delivered. It's who we are, and this program really exemplifies that. The certification, the program itself, the commitment to serving patients with sensory needs really speaks to that. This is an important part of our community, and as you heard, this is an exception. This is not something that's offered everywhere. This is yet another expertise and focus that we bring to healthcare delivery in Southwest Florida that's unique. It's unique to this environment, and it's unique nationally and even across the globe. I want to recognize the team here at Golisano. Again, I want to recognize Alyssa Bostwick and Imad Salman for their leadership. They saw that there was an opportunity here to better serve the community. They saw with some hard work, diligence, and a little investment, there was something great that we could do here, again, for this community. The entire Golisano team, all of the staff members, both here and throughout the rest of the organization, the parents, the Family Advisory Council here, you each made this happen. It's with your effort and your attention that this was able to happen. And to the community here all around us. Lee Health is better for it, for your commitment, for your passion, and for what you bring to the table. We take immense pride in the work that is done within these walls and all of our walls, and the impact that we can have on this community every single day. The young people that walk through these doors are our absolute focus. And what we've done here is yet another way to serve. Lee Health, as you know, is rooted in going above and beyond to serve the community. And again, this program shows that commitment to do even more to support those in need. So thank you all for your effort, and thank you everybody for being here.
Thank you, Dr. Gunsenhauser. I want to take a moment to extend our sincere gratitude to our donors. We would not be here today without the support from so many of you, from the Lee Health Foundation, our Little Red Wagon Fund, Barbara's Friends, Children's Miracle Network. I want to recognize Erica from the Golisano Foundation, who is here today as well with us and is a very big supporter of ours. There are so many people who help fund this program. The total cost of all of the education was completely philanthropically supported. So without that donations, without those donors, this could not have been a reality for us. I want to recognize another group that helped us not only achieve this milestone, but bring in some amazing ideas that continue to make us better. Our Patient and Family Advisory Council, which is a council made up of a group of parents who have children that have been treated or are currently being treated in our hospital or within our team. And I'm honored to introduce Beth Fougere. She is the chair of our Patient Family Advisory Council and has been instrumental in this program and the announcement of this program. And I'd like to invite her up to share more about her passion and the impact of this on her family and family like hers.
Good morning. If you could only stand here and see what I'm witnessing. It's beautiful. Love. When my son was in preschool, I went to pick him up one day. The preschool room had 35 to 40 children. It was partitioned into 3 rooms. The turtles, the froggies, and the bears. Blakey was a bear. I saw that he was in the back of the room, sitting at a table with another little boy. His teacher had let me know that he had been there all day. I knelt down to Blakey and I said, "Hi, sweet boy. How are you? And who is your friend?" And he said, "My friend is sad, and he is scared, and he misses his mommy, So I sat with him today. I whispered to Blakey, I love you. Let's go get some ice cream. In the weeks to follow, I never saw that little boy again. I later learned that he was diagnosed with autism. Kind of ironic, 36 children in a classroom, and the one is sitting at a table. In the years to follow, both my sons would be diagnosed with an ultra-rare disease, the 1 in 10. A disease that would literally overnight force me to be a complex medical mother, and would often remind me of what's really important. I will be returning my children to God at a very early pace. But I remember that day vividly, because at a table in the back of a preschool room sat the 1 in 36, with the 1 in 10 not speaking, but having the most eloquent conversation. 100,000 children in Lee County and 50,000 children in Collier County ascend to the public school systems under the age of 18. 1 in 36 is autistic. 1 in 10 have a rare disease. 1 in 6 have at least one cognitive dysfunction, which renders a sensitivity to their senses. When I learned about the certification, I immediately became involved. I volunteered to be on the task force, but I challenged that task force that education was only the beginning, it was not the ending. How would we turn this into action? Well, you're looking at it. Sea star. In nature, starfish mean divine love. It's underpinned by healing and strength. I could not imagine a more important and relevant symbol for the children of our community to see as they enter this facility. I can't imagine it being any other way, Melissa. 4,175 children in Lee and Collier counties have autism. 7,500 children have a rare disease. Over 15,000 children have at least one cognitive dysfunction, rendering concern with their senses. And we stepped forward. We stepped forward into the light where darkness once was. And that's a beautiful thing to witness. So to those children, we hear you. To the families that have trepidation because all they want is a healthcare that's wonderful and excellent and safe. We see you. To the mother who reads stories in the morning and advocates in the afternoon and wishes upon the stars at night for gentle peace. I understand you because I am you. Today, Golisano, Lee Health, and the Lee Foundation took a step forward. They took a step forward to what inclusion actually means. Today, there is an open chair. There's an open chair at a beautifully built table. An open chair where a little bear can walk through the front door and feel welcome. Feel a little less scared. And and not feel alone. Today is an inspiring day. Today is beautiful. Today is about inclusion. That is Sea Star. And that is beautiful. And that is love. Thank you, Alyssa, for this opportunity.
Y'all can see why she is such an incredible partner to have in the care that we provide here, so I cannot thank you enough. That was beautiful. It truly has taken a village to bring us here today. I want to take a moment to thank just some of those individuals in that village. I'm going to thank somebody that's probably not here, and her name is Jen Campbell. She is now a nurse manager in OB, but she is the one that introduced me to IBCCES and the education and the certification process a little over 2 years ago. Brought it to me on my desk and said, we need to do this. There's no reason we can't do this. And because of her, we did. I want to take a minute to thank Diane Rodriguez, who's in the crowd here today. She is our lead house supervisor. She coordinated, supported, followed up on over 600 individuals that had to complete education modules to obtain that certification. Again, without that oversight and maintenance, we wouldn't have completed that in the timely fashion that we did. I want to thank our leaders, our team members, for their investment and their dedication to this process. It has taken time. It has taken your dedication. It is an investment, and I thank you for that. I want to thank Nikki Shimko, Frazier, and Harrison H. Power, and the entire infrastructure team that Beth spoke about and was part of that has invested hours into the IBCCES recommendations and spearheaded those changes in our processes and our infrastructure. I also briefly just want to recognize too that we do have Kathy Bridge-Lyles in our audience. She's one of our board members. And I'm so thankful you're here today. I know Kathy's heart is in this place and in the care of kids, so I appreciate you being here today. I also want to extend my sincere appreciation for the International Board of Credentialing and Continuing Education Standards, and I have to read that every time because it's a mouthful. IBCCES. And I'd like to introduce President Meredith Teagan, who is here with us today, and I'd just love her to come up here and share with us a little about what you do, what IBCCES does, and what the certification program means from your perspective.
Wow, so Beth, thanks for being very difficult to follow. I'm really excited to be here. IBCCES, our whole mission is to improve the quality of life for individuals with a variety of needs, differences, strengths, and abilities. So we do a lot with autism and sensory needs. We have other types of programs as well. But we've been around since 2001. We started out working with healthcare professionals way back when because we knew that we wanted to provide education and training that was different than what professionals were already getting. We wanted to include the perspectives and best practices from the lived experience from autistic individuals and those on the spectrum, as well as other kinds of clinical expertise and viewpoints, and really kind of try to bridge the gap amongst all the different specialties and professionals that are working with individuals every day. So it's amazing to be at this event and to see the passion and dedication. As far as our certification programs, again, we work in all industries, but the program that this facility has gone through includes the training, which was mentioned. Again, bringing a variety of perspectives and practical strategies for professionals to make the experience more inclusive. When we think about the 1 in 6 folks that have a sensory need or sensitivity, or those that are on the spectrum, a lot of times, unfortunately, even in the age of autism awareness and all of the information that we have at our fingertips, there's still a lot of stigma and a lot of difficulty with just day-to-day things. Going to the grocery store can be very scary, let alone having a medical need or needing to utilize services, going a place you've never been before, doing things that you've never done before, especially as a kid. So for professionals who have the goal of providing the best patient care, and then for families and individuals who want to receive that best care, we all have the same goal, but what's different is we, the professionals or the ones providing the services do need to do a little bit more to be accepting, to be understanding, to think outside the box, to challenge the status quo, to really go above and beyond to provide care. And Golisano is the embodiment of that. Our certification, as mentioned, isn't just given to anybody. You have to meet the training requirements. We do an on-site visit. We provide a roadmap of recommendations for other ways to be accessible. And there's renewal requirements. We provide ongoing support. We provide check-ins. We provide ongoing learning opportunities. And you have to do, just like with any good credential, you have to do ongoing learning in order to stay certified. This is not a one-time thing. This is not a check-the-box type of thing. So all the facilities we work with go above and beyond, but especially in this situation, the certification, as Beth mentioned, is just part of the journey, and this is exactly what we hope for when we work with organizations and healthcare partners in particular. The certification is critical, but so is everything else, wrapping around the services, the C-STAR program, the commitment to providing other tools and resources for families, getting creative. This is exemplary. What is happening today is astounding. And IBCCS is a global organization. We work all over the world with partners, and this is an example that we can share with other partners all over the world, and to show that it does take time and effort and commitment, but at the end of the day, of course, it's worth it. And I just can't, I guess, overstate the fact that this is going to change lives. This is going to make people feel comfortable and welcomed in places where they haven't felt comfortable and welcomed. Places where they were afraid, now they have safety and peace. Even though they might have had a good experience with individual, professionals in the past, or maybe they've been to this facility for other needs, stepping outside and saying, we welcome you, we want you here, we have the tools and resources, we have this for you, really, really can just change the lives of so many folks that have just felt on the outside, and really just, it's not fair that for so long such a huge part of our population has felt like they just didn't have their needs met. So congrats to the team. IBCCS is really proud to be a partner, and we are here for years to come as the program grows, and continue with providing supports, and just to see all the great work that the team here is doing. So I'm excited to be here, excited to officially announce the Certified Autism designation, as well as all the other amazing things the team here is doing. So congrats and thank you.
We're almost done. Thank you, Meredith. It has been truly amazing working with and learning from your team. I can't tell you the amount of emails and phone calls we've had to say, what do you think about this? Can you come look at this? What's your opinion on this? Because we didn't just want to do it, we wanted to do it right. And so I so appreciate your partnership. Before we wrap up, I'd love if you could, and I want to make sure we have our timing right, Nikki. Got it, okay. Before we wrap up, I would love to direct your attention outside through those windows to one other fairly large piece of the puzzle that shows this commitment to our community and our commitment to serve. And I'm trying to draw it out. Pretty long. It's coming. There it is. Pulling up now is the first of its kind. Sensory-friendly ambulance to serve Golisano Children's Hospital. This ambulance is equipped specifically with therapeutic sensory devices, all designed to address a patient's needs and mitigate the impact of the already stressful situation of arriving in an ambulance. From low lighting to noise-canceling layers that make the interior quiet, this ambulance takes into account all 5 senses and mitigates for things that often negatively impact our sensory-sensitive family members and friends. It's unlike anything that has been created before, and it's made specifically for use here at Southwest Florida's only children's hospital for the kids that need it in our community. This commitment to care no doubt will support every patient that comes into our hospital, regardless of their need. And I do want to give a special shout out to Beth for this one, because when we pulled in PFAC into this process, she said at the table, the most sensory overstimulating piece of coming in here is an ambulance. What are we doing about that? And we happened to have an ambulance that was getting remounted, and so with Nikki's help and Frazier and Harrison H. Power, they jumped right in and made it happen. But without that call out and without that input from our family members, we would have missed it. So again, thank you for that. Before we end, and what I'm gonna offer everybody to do when we end is to head outside toward the ambulance. We can get interviews, answer questions, and if you walk past the ambulance around to our flagpole here, you'll see that we have a Sea Star flag raised. And we raised that Sea Star flag because we want it to be a signal to our community. So when you're driving up to this hospital, it says to you as you drive into our parking lot, we're ready. And so that will be hanging out there too for you to see. But first I wanna offer this. I'm up here today as a chief nurse. But first and foremost, I'm a mother. And I'm gonna try really hard here. And I'm the mother of an autistic son. And totally lost my words. Okay, I'm good. And when I heard Beth talk, it's interesting because the same exact words that came out of her mouth were gonna come out of mine, and that is, I know the feeling as a parent when you have to leave the safety of your home with an autistic child. I know that feeling in the pit of your stomach because you're scared and you're worried about what the world is going to think about the uniqueness of the way your child behaves and acts, and maybe the special things that they need when they walk outside into the world, and I know that feeling. And so what I'm here to tell you today is that we are sensory trained, we are aware, and we are ready for your child and your family to walk into this door. And when you come to Golisano Children's Hospital, you don't need to have that feeling because we got you. Okay, thanks, Bob. So first of all, I thank you all for coming and for listening. I welcome you outside. You have to see the inside of that ambulance. It's incredible. You do have to close the doors to get the full experience, but it is an incredible thing to see. And then walk outside and take a look at our flag there as our signal to the community. So thank you everybody for coming.